Hi, here we are now in Psych 2, looking at the second part of personality theory and assessment. Now what I'm going to do in the second one here is look at more of the current theories of personality, and we'll look at a few theorists that sort of focus on a particular area of personalities that's more current, and then we'll look at assessment techniques and strategies and what's been used to sort of evaluate and diagnose, if you will, personality. And that's what we'll do for this particular one. And this is week 9, so we're getting near the end, and I hope you're enjoying your semester. And good luck on the rest of this semester, and good luck on this chapter. Thank you, and let's get on with this.
Okay, what we're going to look at here is starting at trait theories. Now, a trait, it's a stable and consistent personal characteristic used to describe or explain personality. You might be considered sociable, moody, shy, friendly. These would be traits. So trait theory is an attempt to explain personality and differences among people in terms of personal characteristics. And they are fundamental building blocks of personality. We'll start with, on trait theory, Gordon Allport. Now, for him, a person inherits a unique set of raw materials for given traits. These raw materials are then shaped by experiences. Now, what he termed was a cardinal trait. Now, a cardinal trait is a trait that's so pervasive and outstanding that almost every act seems traceable to its influence. A person may be known or identified by that trait. Now, the picture of Abe Lincoln there, he's posted there because Abraham Lincoln was spoken of as Honest Abe, because of the honesty that he displayed as a young man. And so he became known as Honest Abe, and that became a cardinal trait. You know, all through his life, he was known for and sort of described as an honest person. The trait would be mentioned in writing. This is how you would, if you were writing a letter of recommendation to yourself, about yourself, some of the things that you would be including in your reference later would be traits, things that you thought were characteristics about yourself that were strong, positive, and beneficial to somebody else. Now, another theorist is Raymond Cattell, and his theory was that of surface traits. These are observable qualities of personality. Using observations and questionnaires, certain cluster surface traits appear together time after time. Things like helpful, honest, and kind, these traits tend to cluster. Source traits, on the other hand, were deeper, more general, underlying personality factors. And he looked at what he considered to have 23 source traits that were found in normal individuals. Studied 16 of them via the 16 personality factor questionnaire. And the amount of source traits can vary from individuals, kind of like intelligence. And so we're seeing this theory get more refined. What Hans Eysenck did was he created a 5-factor theory for personality. And he looked at these factors as having the 5 primary ones: openness to experience, conscientiousness, extroversion, agreeableness, and neuroticism. Now I'm going to go through each of these one at a time. Openness to experience. This was open to experiences, imaginative, intellectually curious, and broad-minded. Someone who is curious for new information, isn't pre-labeling things, is prepared to learn and not judge things beforehand, as opposed to someone who's more concrete-minded, practical, and narrow interests. So it would be on a continuum again, this sort of, are you open or more closed? Now, conscientiousness, the high conscientiousness is somebody who's dependable, organized, reliable, responsible, thorough, hardworking, and persevering. Whereas someone with low conscientiousness would be undependable, disorganized, impulsive, unreliable, irresponsible, careless, negligent, and lazy. Now, that would be either end of this continuum, and people's personality, from Eisnick's perspective, would fall somewhere in between those two highs and lows. The same for extroversion. Extroverts will be sociable, outgoing, talkative, assertive, persuasive, decisive, and active. Introverts were more withdrawn, quiet, passive, retiring, and introspective. Agreeableness, now, if you were in high in agreeableness, you'd be pleasant, good-natured, warm, sympathetic, and cooperative, and low would be unfriendly, unpleasant, aggressive, argumentative, cold, hostile, and vindictive. Now, again, this is on a continuum, and it doesn't mean that you would be on one end or the other. You would fall somewhere in between, and it may even vary. I mean, for the most part, it's a pretty stable set. So if you were, argumentative, you tend to, someone says black, you say white. It wouldn't be that you're that way all the time, but there might be an area in your personality where, depending on circumstances, that might be you. Neuroticism. Now, this is the part that you have to understand the term neuroticism. This is about emotional stability versus instability. So this isn't the sort of psychological disorder of neurotic. Neuroticism is about is that continuum of emotional stability and emotional instability, where instability is experiencing negative emotions. You're moody, irritable, nervous, and worry a lot. Whereas someone with stability would be emotionally stable, calm, even-tempered, easygoing, and relaxed. Now, because this is all on a continuum, you should be able to imagine that any number of the people that you know would fall in on every one of these factors on somewhere else on the continuum than where you would land. So that would be what describe that person's personality. Now, if we go into another realm, another lens, if you will, of researchers, you start to get into social cognitive theories. And Albert Bandura did a lot of work in the area of social cognitive theories, not just in personality, but in regards to personality, he came up with what he would call reciprocal determinism. This is the influential mutual relationship among behavior, cognitive factors, and the environment, which contribute to our sense of who we are. And so if we looked at behavior, it's the personal, which would be the observable behavior, the environment, which would be the reinforcers that we get and the models that we observe people doing, and the cognitive would be belief, expectancies, and personal dispositions. Now, he also included self-efficacy. Now, self-efficacy is the perception of ability to perform competently whenever it is attempted. So if you have high self-efficacy, you approach new situations confidently, you set high goals, you persist in effort because you believe success is likely. Where someone with low efficacy, you expect failure, you avoid challenges, and you give up on tasks that you find difficult. You likely experience some degree of low, depression where you don't feel good about yourself at times. Now, again, this falls on a continuum. This self-efficacy, you could vary in terms of tasks or circumstances from high to low efficacy. Now, if we continue on in the social cognitive theories, Julian Roeder, he came up with the self-efficacy and locus of control. Now, locus of control explains how people account for what happens in their life. And so if you have an internal locus of control, you see yourself in control of your own behavior and the consequences. You see that you can have an impact on your life. Whereas external locus of control, you see fate, luck, or chance as being what controls your behavior and consequences. And so you're less likely to change behaviors due to reinforcement. You don't see that reinforcements are tied to your actions. This is in terms of external control. You don't see that anything you have to do will influence your life's outcomes. You tend to be a procrastinator, engage in safety procedures more slowly than in a dangerous project. Your lower life satisfaction. Whereas in internal locus of control, you really do feel like you have a direct impact on your life. When things go bad, you can do things to make your life feel better, and that's internal locus of control. if you're an external locus of control, when things start to go bad, you don't think you can make them better. Life is just being troublesome to you. And that's an influence on your personality from Rotter's perspective. Now, if you look into humanistic theory, this is probably something you've heard of before, the hierarchy of needs. Now, in humanistic psychology, people are assumed to have a natural tendency towards growth and realization of their fullest potential. This theory is more optimistic and more sensitive to emotional experiences and are difficult to test scientifically, though. And both Abraham Maslow and Carl Rogers were instrumental in this particular theory area. Abraham Maslow thought that motivational factors are the root to personality. And the hierarchy of needs, well, your personality would be established based on what level of your hierarchy of needs could you meet. So if you think of somebody as homeless, some of their personality, if not a lot of their personality, is motivated by the motivation for the need for safety, biological needs like food, oxygen, water, sleep. Whereas maybe you and I, we might be bouncing between belonging and love needs and esteem needs because of how we live our lives and what we're motivated by. We already know we have our biological needs and our physiological needs. We maybe even already know we have our safety needs. So we might start being motivated by the need to be loved and to love and the need to affiliate with others and be accepted. And if we have that already, then we are motivated to esteem needs. Now, if we can move all the way to the top, and both Rogers and Maslow argue that not very many people manage to meet all the needs, including the need for self-actualization, and fully meet that. But a self-actualizer can accurately perceive reality. They don't need to build it up or tear it down. They see it as it is, and they approach life as it is. They judge more honestly and quickly, and they are able to spot honesty and fakeness pretty easily. They're comfortable with life. They accept themselves, they accept others, and they accept nature as it is. They have a good sense of humor, and they're tolerant. They believe they have a mission to accomplish and feel the need to devote their life to something larger and better than themselves. They do not depend on external authority or other people to direct them. They have relationships that are characterized by deep and loving bonds. They can laugh at themselves. They find deep meaning and insight and harmony with the universe. Now, the conditions of worth, the positive regard, this is conditions of worth is what comes from Carl Rogers mostly. This is where positive regard hinges on parental conditions. And positive regard would just be people feeling good about you and expressing that to you, that you are good because you are you. They live and act according to someone else's values, gain positive regard by defying your true selves. This inhibits your behavior and denies or distorts perception. So the idea behind the goals of theory would be enable people to open up to experiences, begin to live according to your own internal values. Unconditional positive regard would be a positive way to unleash that possibility for you. Now, we don't have a single theory to explain personality, and there's never a single explanation for any social phenomenon or any personal phenomenon. And so we have a variety of ways that we might assess personality. And one of the first and most important would be observations, then interviews, and we could use rating scales. Now, observations are used in a variety of settings to assess personality. These observations can be used in hospitals, schools, clinics, and workplaces. Interviews, well, they help diagnose in the treatment of patients. Screening applications for admissions to college are oftentimes done as an interview to see if you have the kind of qualities that a university or a college might want. Special programs, evaluating job applicants or performance. And so when you go for an interview, part of what they're evaluating is your personality and its appropriateness for the kind of job they're asking for a hire for. You can evaluate through an interview a person's tone of voice, their speech, mannerisms, gestures, and general appearance is also considered. Structured interviews include prearranged questions and formats. And then rating scales, well, these are used to record data from interviews and observations, provide a standardized format, help focus raters' attention on all relevant traits. Now, the limitations are that the rating can be subjective, the tendency of raters to be excessively influenced by their overall evaluation of a person by one or a very few favorable or unfavorable traits. So there are strengths and weaknesses to personality assessments, and this is an important element that all ratings go through, is whether they're reliable and whether they're valid. So if we look at some example of inventories, these are paper and pencil tests. They contain questions about a person's thoughts, feelings, behaviors, and they measure several dimensions of personality. What you see in the bottom right would be a graphic representation of a particular inventory where you can see the degree or the amount of what personality traits might be a part of your experience. Can be scored according to a standard procedure. It yields a personality profile, and what you see on the right would be a personality profile. And where does a person fall on these various dimensions or traits? Now, the Minnesota Multiphasic Personality Inventory, the MMPI-2, this is the most widely used and heavily researched personality inventory. It aids in diagnosis of psychiatric problems and disorders. It was originally administered to a group of psychiatric parents, used over 1,000 questions about attitudes, feelings, symptoms, and they retained about 550 items that differentiate psychiatric patients from those that are considered normal. The second edition added items on alcoholism, drug abuse, suicidal tendencies, eating disorders, and type A behaviors. The validity scales integrated to detect who are those who are lying. So they try to create checks and balances in their assessments to weed out people who are lying, faking a psychiatric illness, faking no psychiatric illness, or does not reveal any normal personality differences very well. And so these tests are done in such a manner to sort of, if you will, the way that often these tests are done is they have what's called hot questions, and hot questions would be key questions that, when answered, give insight into personality, where some of the questions are not hot questions. And this is one way they try to weed out the lying and the faking. Now, another type of test is called a projective test, and the Rorschach ink blot method is an example. It's a personality test in which people respond to ink blots, drawings of ambiguous human situations, respond to incomplete sentences, or project their inner thoughts and feelings or fears and conflicts from these images. So while viewing 10 ink blots, the test taker is asked to describe everything that he or she thinks about the ink blot, what the ink blot looks like or resembles. Standardized scoring developed aids in a normative data. It just after a lot of people had used the same ink blots, there would be a pattern that would be emerging over the kinds of responses people would make and how that might translate into a more standardized view of categories for personality. And then the last test we'll look at is the Thematic Appreciation Test, the TAT. And this is useful in assessing personality and achievement. There's a blank card and 19 other cards showing vague or ambiguous black and white drawings of human figures in various situations. And the test taker is told to make up a plot or a story which might be used as an illustration. And what is the relationship between the individual and the picture? What are the thoughts and feelings? What would be the outcome? The strength of the TAT is its capacity to reveal things that the patient is willing to tell or unable to tell. Time-consuming as it might be, and difficult to administer and to score, it revolves around a fair bit of making educational guesses, and that can be a real struggle with determining and sort of evaluating and scoring the TAT. It relies heavily on interpretation skills of the examiner. It may reflect too strongly on the person's temporary motives and emotions. And so the personality is quite a funny concept in that we don't really know exactly what it is, and we don't have a reliable way to measure it and determine what it is. So that's the end of part 2, personality theory and assessment, and I look forward to seeing you in week 10. Keep up the good fight. Bye for now.